Is your body quietly sending cancer warning signals you might be missing? What subtle clues could point to cancer developing inside you? And why do these signs so often slip under the radar? Cancer impacts millions of people worldwide every year. Yet its early symptoms are frequently misunderstood or simply ignored. Recognizing them early doesn't just aid detection, it enables prompt action that can greatly improve treatment success. So what exactly are these warning signs? And how do they differ from person to person? In an era flooded with information often shaped by commercial interests, the real early indicators of cancer can get lost in the noise. We're here to cut through that confusion and deliver clear, evidence-based signs you can trust. Stick with us as we walk you through each one, so you can better interpret your body's messages and know when to seek medical help. Quick disclaimer. This content is for educational purposes only and is not a substitute for professional medical advice. Please consult your healthcare provider about any health concerns. All information is drawn from credible, peer-reviewed studies. References and links to original sources are included in the description for full transparency. 1. Persistent fatigue. Persistent fatigue may rank among the very first clues that cancer is developing in your body. If your energy crashes dramatically and no amount of sleep or rest brings relief, take it seriously. This isn't ordinary tiredness after a long day, it's profound, unrelenting exhaustion. The symptom often links to blood cancers such as leukemia or lymphoma. These diseases disrupt bone marrow and blood cell production, leaving you drained despite rest. You might also notice muscle weakness or mental fog. Such issues can stem from cancers that alter hormone balance or cause hidden bleeding, including colon or stomach cancer. When cancer interferes with normal body processes, constant tiredness and related symptoms frequently follow. People commonly blame prolonged fatigue on stress or overwork. But if unusual exhaustion lasts for weeks, seeing a doctor is essential. Medical tests can uncover whether something more serious lies beneath. Listening to your body matters. Fatigue may feel minor, yet when unexplained and ongoing, it can signal a major concern. 2. Persistent headaches. A headache that refuses to improve with over-the-counter or prescription medication deserves attention. If it continues beyond 2 weeks, consult a doctor promptly. This pattern can warn of serious conditions like brain tumors or other brain cancers. Additional neurological signs often appear alongside it. These may include blurred or double vision, hearing changes, or facial weakness. Whenever such symptoms accompany a stubborn headache, seek evaluation right away. Seizures or other sudden neurological events also require urgent medical review. They can indicate important brain changes that need immediate care. Brain tumors sometimes press on nerves or disrupt normal function, triggering these effects. Ignoring a long-lasting headache plus related symptoms carries real risk. Not every headache points to cancer, yet those unresponsive to usual treatment and prolonged must be thoroughly investigated. Early discovery can dramatically improve outcomes for brain tumors and similar conditions. Paying close attention to your body is crucial. If persistent headaches come with neurological changes, don't delay professional help. Caution is always wiser, better to confirm your health and receive proper care. 3. Unexplained or new pain. Pain that lingers without any clear trigger, like injury or known illness, and fails to improve with routine remedies should be checked by a doctor. Pain serves as your body's alert system for underlying trouble. When it persists without explanation, cancer could be the cause. For men, ongoing abdominal pain might point to prostate, bladder, testicular, or penile cancer. In women, unusual breast pain or tenderness can signal breast cancer. This type of discomfort feels atypical and doesn't ease with common fixes, hinting at a deeper issue. Pain can also arise from internal cancers. For example, persistent heaviness or swelling in the scrotum may indicate testicular cancer. Likewise, constant abdominal pain could suggest liver or pancreatic cancer. Such pains are frequently dismissed as minor or attributed to less worrisome causes. Yet they deserve careful attention. Disregarding unexplained, ongoing pain is dangerous. It's tempting to downplay it, but when pain endures with no obvious reason, thorough investigation becomes essential. 4. Excessive or unexplained bruising. Bruising that appears excessively or in unusual spots without any obvious cause can point to certain blood cancers. If you start noticing bruises popping up for no clear reason, consult a doctor right away. These bruises may signal problems with blood cells, such as leukemia. Leukemia impairs the body's ability to make healthy blood cells, often resulting in easy or excessive bruising. The marks can show up on arms, legs, or other unexpected areas. Never dismiss this symptom, it can be an early indicator of a serious condition. You might also experience frequent nosebleeds or bleeding gums. These too can be linked to blood disorders or cancers. Any of these signs together make it essential to get checked by a healthcare provider. Stay alert to unexplained changes in your body, including random bruising. Cancer reveals itself in varied ways, and spotting early clues is critical for timely detection and effective treatment. 5. Persistent cough or hoarseness. A cough or hoarseness that lingers beyond 2 weeks should be evaluated by a doctor. A dry, persistent, or irritating cough that doesn't get better may indicate lung cancer. Coughing up blood or noticing blood-streaked phlegm is especially alarming and requires immediate medical attention. Ongoing hoarseness, a raspy voice, or strained speaking can also serve as a red flag. If voice changes come with trouble swallowing or pain in the throat or neck, these could suggest thyroid or throat cancer. People often brush off chronic coughs and hoarseness as minor annoyances. Yet when they refuse to resolve, they may point to far more serious issues. Lung cancer, in particular, frequently causes a stubborn, treatment-resistant cough. If your cough or hoarse voice lasts longer than 2 weeks, see a healthcare professional to identify the root cause and receive proper care. 6. Blood in urine or stool. Seeing blood in your urine or stool is a serious red flag that should never be ignored. Blood in stool may look black and tarry or bright red in urine. It can appear pink, red, or dark brown. These signs often point to significant health issues, including cancer. Blood in the stool can indicate digestive cancers such as colon or rectal cancer. It may also result from inflammatory bowel disease or ulcerative colitis, which disrupt normal gut function and cause bleeding. Similarly, blood in the urine could signal prostate or bladder cancer. It might alternatively stem from urinary tract infections or other urinary problems. Any visible blood acts as a clear alert that something is wrong and requires professional evaluation. These symptoms demand prompt assessment to pinpoint the cause and start appropriate treatment. Your health is far too important to overlook these critical warning signs. 7. Non-healing mouth sores. Mouth sores or ulcers that fail to heal within a couple of weeks deserve serious attention. If you notice persistent sores, lesions, or white patches on your lips, tongue, gums, or anywhere inside the mouth, get them examined right away. Such changes can be indicators of oral cancer. Oral cancer may develop in any area of the mouth, including the lips, tongue, or throat. Heavy tobacco use or excessive alcohol consumption raises the risk considerably. Prolonged mouth sores should never be dismissed, especially when paired with difficulty swallowing or unexplained weight loss. White patches known as leukoplakia are another potential warning. Leukoplakia is a precancerous condition that can progress to cancer without treatment. These patches may seem harmless, yet they require evaluation by a healthcare provider to determine the best course of action. Ignoring persistent mouth sores can lead to grave outcomes. Oral cancer often advances quickly, making early detection essential for successful treatment. 8. Changes in urination or bowel habits. Noticeable shifts in your bowel or urinary patterns can be an early clue that something is amiss. Ongoing constipation or diarrhea lasting several weeks should prompt a visit to your doctor. Though these issues may feel minor, they can signal serious conditions, including cancer. Persistent changes in bowel habits might stem from inflammatory conditions like Crohn's disease. However, they can also warn of colon or stomach cancer, which disrupt digestion and alter bowel frequency or comfort. In the same way, urinary changes, such as pain during urination, increased frequency, or a weak stream, may indicate urinary tract problems. These could arise from an enlarged prostate, infection, or more concerningly, prostate or bladder cancer. While less serious causes are possible, such symptoms can also serve as early cancer alerts. It's always wiser to investigate thoroughly and rule out major issues rather than ignore them and allow a treatable condition to worsen. Taking charge of your health means heeding your body's signals. If you experience any lasting changes in urination or bowel habits, consult a healthcare provider promptly.